Welcome back and thank you for staying with us. Now let's talk about something that is immediate. The Presidential Task Force on COVID-19 says Nigeria may be on the verge of a second wave of the pandemic with surging cases across the nation. PTF Chairman and Secretary to the Federal Government, Boss Mustafa, explains that there is a rise in the number of cases in 23 states, as 4 states, Lagos, Rivers, Ogun, and the FCT, now have the highest case counts. The PTF also plans to make we shall go into that later. Let's talk about this second wave, which seems to be imminent. A number of people have passed, more than usual, and the numbers are rising. So, should we pay more attention? I think the answer to that question is yes. But then we have specialists with us who are going to tell us more about what we should be doing. In the studio in Lagos, we have Dr. Ladapo Ashiyombi, who is a public health physician.
Good morning.
Good morning.
Good morning.
And joining us via Skype is Dr. Ado Mohammed, Global Director, D8 Health and Social Protection Program. Good morning, Dr. Mohammed.
Good morning, Channels TV, and good morning, Nigerians.
Thank you for joining us. Now, let me start with you since we have you in our pocket in Lagos, Dr. Ashiyombi. Is another lockdown imminent with all these rising figures?
Wow. I think it cannot be ruled out. I did not say it is there. These, my choice of words were very clear.
Yes. Are you being diplomatic?
I'm being real.
Okay. You're being
real. When cases are rising, what will give you a pointer to that makes Nigerians become a bit more serious is that we're now hearing more high-profile deaths, which seem to be on the lower side in the last 2-3 months. So in epidemiology, that's called like an iceberg effect. In an iceberg, you see about 2 to 3% of the iceberg above the surface of the water. Majority of it, like what sank the Titanic, is under the surface of the water. So the high-profile deaths we hear them because they are high-profile. So there are many more low-profile deaths that we will not hear. And that is a pointer to the number of cases. So we have the highest number of single-day cases. I think yesterday, 769 or something. Since we started, even at the peak in mid-June, July, yesterday's number of cases has been the highest. And while watching CNN, I saw that America too also had the highest number of cases this week, 1 million cases.
Germany?
Yeah. Mm-hmm. So you see, it's mirroring. While ours is just 769, it's because we're not doing enough tests. But it is even a good thing that we can use that as a mirror. It's the highest ever
so far
in one day. So it tells us quite a lot of things are happening. And the reasons are very simple. When you reduce social distances, when you disbelieve health advisory, on the false belief that there is no more COVID. And everywhere has opened up. Schools have opened. Markets have opened. Offices have opened. Shops have opened. In fact, the biggest one is parties have begun, big scale. Now, add that to the number of conferences we now have. I mean, there was a scare of a big high-ranking military officer who died. Nobody says what killed him. But we know he died after a big military conference. And that conference was aborted. So, if they had kept the advice, no unnecessary gathering. In the height of the cases before, we were doing these conferences, but we were doing them remotely. And we were okay. So, I think we should just look at it and...
Okay. Now, Dr. Mohammed, these figures are becoming very scary. And like Dr. Ashinyombi said, we are hearing of more high-profile citizens biting the dust, so to speak. What should we be doing which we are not doing, which is causing this rise in numbers?
I think the fact that we are now in second waves is obvious, and the reason why we're in this situation is because we have a false sense of relief that the virus is no longer with us. Unfortunately, people have resumed normality in terms of life and livelihoods, in which, you go around the streets, you don't see people even wearing masks. People do not even uphold and abide by public health guidelines like physical distancing, like washing of hands, and then like avoiding unnecessary attendance at big, large gathering. You see people going to even a mosque. People without even face masks congregating. You see people in churches, and then you see events and weddings taking place. So the challenge is that people have resumed their normal way of doing things without abiding by the guidelines that have been set by the government of Nigeria and by the public health experts. So I think what we need to do is to go back to the drawing board. We need to look at the cases. We need to look at the case counts, and then we also need to see how we can go back to the drawing boards. And when I say going back to drawing boards, the way and manner we responded in the first phase, in which we're able to flatten the curve, we still have to go back to that. And this time around, I think we even need to be much more aggressive in our response, because all over the world, the casualties and then the fatalities due to second wave is much higher than first wave. So we do not want the second wave to overwhelm our health system. We do not want the second wave to overwhelm families, individuals, and households. So we just need to, aggressively respond to this second wave, and that may include enforcement by our law regulatory agencies. It may include enforcement by governments, either at the states, local governments, and the federal level. And we also need to go back to our community structure in terms of ensuring that we use the community structures to advise people to abide and then comply with guidelines, because the consequences of not doing that is better imagined. Our health system will be overwhelmed, the economy will be crippled, and individual families and households will be in a very bad state. So I think we need to take it much more serious than even we took the first wave. I'm happy that the task force on polio on COVID-19 is responding appropriately. But we need to also, as family members, as head of households, as responsible Nigerians, also abide by guidelines and then protocol that have been set.
As at this morning, Doctor, the number on the NCDC COVID-19 website, the figures we have are that 833,755 samples have been tested. Confirmed cases, 72,140. Active cases discharged cases, 65,722. As at this moment, the number of people in facilities having COVID-19 are 5,228 across the nation, and fatalities 1,190. On your screen right now is that website of the NCDC on that. What you would notice in that previous progression page is that the rise this second time is very, very steep. What is responsible for that?
Well, it's simple behavior.
People have lowered our guards.
Just a moment, Dr. Mohammed. We'll come back to you, Dr. Mohammed. Yes, this slide I'm talking about.
Yeah.
What?
It's behavior. The virus does not move. It is human beings that move. So, in the first time, there was so much fear. People were afraid. So, people kept more to the guidelines the first time than now. And the reason is because risk perception. And there are 3 dimensions to health: physical, mental, social. Physical is what happens to you or people. Now, because we're not seeing a lot of physical deaths, people think that their risk is so low. I mean, everybody had predicted Africa will be littered with bodies, but Africa wasn't littered with bodies. And that's because the population that the virus affects the most are the elderly. And we don't have many of them. They're less than 5%. So when we are not seeing a lot of people dying, and the sites of the type of death is a friendly one. What I mean by that is, compare that with Ebola. Before somebody died, they bleed from their ear, their nose, their mouth. When you see that picture, you will take caution. But you will not see that with COVID. Person is likely just going to go to a heart failure, respiratory failure, and just die. So you say, after a brief illness, he died. But when you see someone bleed from their eyes and the nose, you say, after a serious illness. So the fear perception, the risk is low in people's mind. The number of deaths is low, expectedly, because of our demographic program in our mind. So we think, so what's the whole noise about? I mean, we see them dying more in Europe, in Americas. We don't see them. So what is it? So everybody feels, this COVID is not even as deadly as everybody is saying. So our interaction now is more. I know many more people then who refuse to go to church. They will join the online service. But now, no, they've abandoned the online service. Everybody has gone. The same thing in the mosque. Many people will not go for birthday then.
But the risk that you're talking about, which seems to be low, is misplaced, right?
Yes.
Okay. We'll just take a short break. Dr. Mohammed will come to you after the break.
All right, so this is where we are now, Doctor. That question that she asked you, that still plays here, but let me take that same one to Dr. Mohammed. So this is where we have now, where we found ourselves now. The rise is very, very, very steep now, and 2 days back we recorded 690 or thereabout. Yesterday we recorded 700 and something, 769, and here we are now. And it seems that the figures are rising again. We are at risk. And we have just heard that, a good number of public events have held in different parts of the world, especially the United States of America and a number of other countries where they have had protests of large proportions. And as a result, there's been a good number of, risen cases in those countries. What are we going to do now? The president has made it clear we can't afford another lockdown because already we're in a recession. So, what do we do now?
The cases that are being reported are even underestimated. I can show you because we're doing less of testing. We're not doing as many testing as we should be doing. Deaths are not being reported. We also do not have a very reporting system when it comes to morbidity and mortality across the country. So this is just a tip of the iceberg. So much more people are dying from COVID-19, and then much more people are getting morbid from COVID-19. And so what is very clear now is that the second wave is here with us, and we just need to act very fast. The question is, what do we do? Can we afford the lockdown, or do people just comply and abide by guidelines? I think we just need to review our approach. We may have to, I'm afraid we may have to consider a lockdown if it continues the way it's going, because if the cases keep on increasing, and then we also have increasing positivity rates, and then there are more morbidity and mortality, I'm afraid we just have to consider a lockdown as it's been done elsewhere. I mean, you remember that in UK, when the cases, the second wave arrived UK, and the morbidity and mortality was high. I mean, the government considered a 2 week lockdown, and that stabilized it a little bit relatively. So here we just have to go back to the drawing board. We also need to look at the cases in the next maybe a week or so to see whether people will abide by guideline, whether people will resume wearing of face masks, whether people will keep, resume keeping a safe distance, physical distance, and then if people will avoid unnecessary gathering, that may bring it down. But I'm afraid the way the way things are going, I mean, I think we just continue. People continue their business as usual in terms of attending parties, going to events, going to mosque and large gathering without face masks, and then going to churches. So it's either we go on a lockdown or government enforces. But I think the lockdown will damage the economy. If we are not locking down the economy, then it's important that government enforce at the state, local government, and the federal level that people should be sanctioned, and people should be law enforcement officers should ensure that people abide by guidelines. And then we also need to, as much as possible, minimize large gathering. And then conferences, events taking place as if business, are presumed. I think we need to be responsible enough to know that the virus is still with us, and then to protect ourselves, to protect our family, and then to protect our community.
Okay. Doctor, some would say that this virus, this second wave, has picked the wrong time to hit us. This is Christmas time, and I mean, Nigerians and Christmas. It's a big thing. You got to go to that open house in Ayo's house. From there, you move to Dakbo's house. So on Christmas Day, you're doing visiting 4 or 5 people. But from what you're saying now, all that has got to be put in the cooler. Otherwise, we're going to have a serious issue on our hands after the festive period.
Yeah. I purposely made the comparison between Nigeria and America. The 1 million case happened after the Thanksgiving. Because for America, Thanksgiving is even bigger than Christmas. So they have to travel, visit friends and family. And the CDC was clear, please, this year. And they told the CDC, what do you mean? We should not travel. Impossible. In fact, there are more tickets sold in the month of Thanksgiving than the previous 6 months. But 2 weeks after Thanksgiving, the highest number of cases, 1 million cases and over 200,000 deaths in one day. So
what would you be advising us to do now?
We have our own photocopy in Christmas and New Year and Happy New Year. I think we might have to look at it have to look at 2 things. Living, we want to live, and then the quality of life. It's a big balance. One, you have to be alive for you to have a quality life. So,
stay alive
before you so people who are dead will not have any life at all. So the quality will not be there. So what we need to do is reduce the number of these gatherings by ourselves. No government can enforce such things all over the world. So you would have to take responsibility and do it. And now the first thing is reduce social gathering. What they say is unnecessary gathering. So where the gathering is not necessary,
Gentlemen, forgive me a little. There are some people whose livelihoods depend on commuting and community.
Like which people? It's difficult.
Those social gatherings you talk about, those parties, it's the livelihood of some people. And a good number of
the event centers, the caterers, the event planners,
cinema houses, concerts. Of course, a number of organizations are taking precautions. One of the biggest conferences, concerts in Nigeria held yesterday, and it was virtual. And so a number of organizations are doing that already, but communicating that, causing a good number of people in the population to change a culture a way of life integrated over decades, that's a big task.
Thank you. You didn't say the word impossible task. I like you for that. So, see, the people that you say hang, okay, so let's look at an average Owambe party. You see those who came to change Naira, 1,000 for 800. You see those who came to pick pure water. You see those who came to park your cars, even though they have no right to in the parking.
Those who came to pick your pocket.
Those who came to pick your pocket. The only reason why they're all there is because that party is holding.
Sure.
So if government says we don't want any gathering more than 20, if those parties are not holding, then those hangers on it will not come. There will be nowhere to go. The same thing happens in mosque. After the mosque, then you see people are asking you, please give us some alms, because it is one of the tenets of the religion to give alms. So people are there to take. But if that gathering is not there, or is reduced to what may be safer. So what I'm looking at is, I said, the lockdown will not be situational and socially managed based on data and the risk associated with such gatherings. So we might need to tell the schools to please go back to virtual. We might need to tell, because what the children need, anyway, the good thing about it is schools will be on holiday, so we keep it there. So all those other social gatherings, if it is more than 10 or 20 and it is not necessary, then don't go. Even the market, you might need to go back to the 1 day on, 1 day off, and let it be essential. You will not say don't come to the market, to be what used to happen Monday, Wednesday, and Friday. So that's what I think we can do to government. We have, because right to life can only be exercised when there is life.
Indeed.
And I hope that we can all take responsibility and keep safe. And I wish Nigerians good luck.
Dr. Oladapo Ashiyan, the public health physician who joined us in our studio in Lagos, and Dr. Ado Mohammed, Global Director, D8 Health and Social Protection Program, who joined us from Abuja via Skype. Thank you very much for coming to give us advice as to how we should weather this second wave of the pandemic, which seems to be upon us. Sunrise will return in just a moment with the home stretch. That's my partner's favorite part, and he'll be taking it too.